Good afternoon. In this video, my parents Tania Patricia and I will talk about some vital things and how each one of them will be taken.
Temperature. The normal body temperature of a person varies depending on gender, recent activity, food and fluid consumption, time of day, and in woman the stage of the menstrual cycle. Normal body temperature can range from 36.5 degrees Celsius to 37 degrees Celsius for a healthy adult. A person's body temperature can be taken in any of the following ways. Hyperthermia or fever is high to 37 point degrees Celsius and hypothermia is low 36.5 degrees Celsius. How to take temperature. Wait at least 15 minutes after bathing or exercising before taking your axillary temperature. Take the thermometer out of its holder. Hold the thermometer by the end opposite the colored or silver tip. Clean the thermometer with soap and warm water or rubbing alcohol. Rinse with cool water. Turn the thermometer in your hand until you see the line. The line should read less than 35.6 degrees Celsius. If the line reads more than 35.6 degrees Celsius, firmly shake the thermometer downward several times. Shake the thermometer over a couch or bed. This will keep it from breaking if it slips out of your hand. Check the thermometer to make sure it reads 35.6 degrees or Celsius or less. Gently pat your armpit with a tissue. Don't rub when drying your armpit because rubbing warms the skin. Put the end with the color or silver tip under your arm. Hold your arm down tightly at your side. Keep the thermometer under your arm for 5 minutes or longer. Remove the thermometer without touching the tip. Gently wipe the thermometer with a tissue. Hold the thermometer at eye level. Slowly turn the thermometer until you see the line. Each long mark is the same as 1 degree. Short marks are the same as 0.2 degree. Your caregiver may want you to keep a temperature record. Write down the time and your temperature each time you take it. Pulse rate. The pulse rate is a measurement of the heart rate or the number of times the heart beats per minute. As the heart pushes blood through the arteries expand and contract with the flow of the blood. Taking a pulse not only measures the heart rate but also can indicate the following: heart rhythm, strength of the pulse. The normal pulse for healthy adults range from 60 to 100 beats per minute. The pulse rate may fluctuate and increase with exercise, illness, injury, and emotions. Females aged 12 and older in general tend to have faster rates than do males. How to take your pulse. When taking your pulse using the first and second fingertips, press firmly but gently on the arteries until you feel a pulse. Begin counting the pulse when the clock's second hand is on the 12th. Count your pulse for 60 seconds or for 15 seconds and then multiply by 4 to calculate beats per minute. When counting, don't watch the clock continuously, but concentrate on the beats of the pulse. If unsure about your results, ask another person to count a view. Respiration rate. The respiration rate is the number of breaths a person takes per minute. The rate is usually measured when a person is a rest and simple involves counting the number of reads for 1 minute by counting how many times the chest raises. Respiration rates may increase with fever, illness, and other medical conditions. When checking respiration, it's important to also note whether a person has any difficulty breathing. Normal respiration rates for an adult person at rest range from 12 to 60 breaths per minute. To take an accurate measurement, watch the person's chest rise and fall. One complete breath comprises one inhalation when the chest rises, followed by one exhalation when the chest falls. To measure the respiratory rate, count the number of breaths for an entire minute, or count for 30 seconds and multiply that number by 2.
Glucose measurement. Blood glucose testing is used to find out if blood sugar levels are with health limits. It is often used to diagnose or monitor diabetes. How do I measure blood glucose? After washing your hands, insert the test strip if you met. Prick the side of your fingers to get a drop of blood. Touch and hold the tip of the test strip to the drop of blood. Wait for the result, and your blood glucose level will appear on the meter. Arterial pressure. Measure the pressure in your artery with your hands pulse. You can have your blood pressure checked as part of a routine doctor's appointment or as a screening test for high blood pressure. Your arm should be supported so that the forehead is at heart level. Roll up your sleeve so that your arm is better, making sure the sleeve is not squeezing your arm. If it is, pull your arm out of the sleeve or remove your shirt. You are provided with wrap the spirometer snugly around your arm. The lower set of the cords should be 1 inch above the width of the elbow. Then the cold valve of the steering allows the pressure to drop slowly. As the pressure drops, the reading is recorded as soon as your heart, the sound of blowing buzzing. This is the systolic pressure, and as there are continues to flow or the sound appears, the point at which the sound stops is recorded. This is the diagnostic pressure.